All right. While we are filling in, welcome to the 7th talk in our COVID-19 seminar series. I'll start with some introductory remarks about the seminar. My name is Ambuj Singh, and my co-host has a scheduled conflict, so you'll not see the familiar face of Joe Walter, but you should be seeing the faces of our speakers for today. Let me just take you through the schedule a bit in terms of what let me look at the. So let me just take you through the. So this is, as I said, this is the 7th of our talks. And let me share the screen in terms of where we are in terms of our series. So we started with some biomedical aspects on April 14th, then 21st, 28th, then the economic aspects. We looked at modeling, economic aspects, then the social and scientific insights, and then we went back to look at the climate effects of the virus. And today we are looking back at some of the aspects of modeling and prevention issues of the virus. We have 2 other meetings that are scheduled that will take us through the spring quarter. So the meeting likely next week will be aspects of controls and a wider scale of biomedical issues, medical issues around the virus. And then the last meeting is likely to do with the public health. We do have some meetings that are beyond that, so it's likely we'll be going a few weeks into the summer, likely at the same time, but we'll keep you informed. And you can sign up here to receive updates about emails about this series. Let me take you, so with that done, let me try to introduce the speakers for today. So we are excited to have 2 speakers from UCSB today. First is Somaya Dodge. She is from the Department of Geography at UCSB. Her research focuses on trying to understand movement of people, wildlife, disease, all aspects of movement, from the small to the really large. And her talk today will be on an analytical time geography approach to tracing contacts and movement data. And after Somaya, we'll have Meng Yang. He is also from UCSB. He's from the stats department here at UCSB. His research focuses on uncertainty quantification and spatio-temporal modeling and statistics. His title is going to be Preventing a Second Wave, Model Forecast and Available Data Sets. So to remind you, if you have any questions, please raise them as a part of the webinar, and I will translate those questions and I will pass them to the speakers at the end. So with that done, we should start with the first speaker. Somaya, it is over to you.
Thank you.
Thank you.
Thank you. Okay, let me share my screen. Is it working?
Yes.
Great. Thanks, Manyang, for the introduction. Thanks, Ambuj, for the introduction and for everyone to join this meeting. Sorry, I cannot be present in person, but thank you for attending this seminar. Today, I would like to talk about my research on analyzing movement data, specifically to trace contacts between individuals using GPS tracking data. So before I go to the details of methodology, I would like to give you some background about what movement data are and how we collect movement data and how we use it to analyze and model movement behavior of individuals. So in general, we have two modes of data collection for movement. One way of collecting data would be to collect in the Lagrangian model, which basically using a GPS sensor, we track the individual movement as it moves, and we basically follow the individual path along their trajectory. So that would be the top figure. And in the bottom, we have the other model, which is called Eulerian approach. And we basically use a set of sensors that are in different locations, and we sense the individual as it moves through the space. For instance, if you have Wi-Fi networks or cellular networks or card readers or scanners, when individuals move in space and time, we can record their presence in one specific location at a certain time or not. Based on this approach, we can't basically track the individual continuously. However, we can use the locations that are collected in time and put them in order in time and reconstruct the trajectory. What is trajectory? Basically, here you see a trajectory of one albatross moving or flying between Galapagos and Peru. And basically what we see here is a set of points or locations that are ordered in time. And we quantify movement using trajectories because we can't continuously collect movement data, but we have discrete locations over time, and we use that to compute movement trajectories or any a measure of movement. These trajectories basically carry a lot of information about movement behavior of individuals. For instance, using these trajectories, we can compute the speed of movement, we can compute other parameters such as distance that these individuals traveled, or locations that they stayed. For instance, if they stayed home, how long they stayed home, and the amount of time that they spent traveling or staying in a certain location, the duration of movement, etc. So we get a lot of information using trajectories. We can also contextualize trajectories either in real time as we collect movement data using multimodal sensors, collecting behavioral information or environmental information, or we can basically attribute geographic and environmental information to trajectory points after data collection using remote sensing data, census data, network data of road networks, and we can assign or attribute weather, demographic information, traffic information to these trajectory points, and then later on we can analyze it to basically correlate a movement with context in space and time. Movement data are currently being used a lot thanks to ubiquitous tracking of individuals using cell phones. And we all are involuntarily contribute movement data to a lot of different companies. Some of them are mentioned here. And basically, whenever you are using your cell phone or your location-based apps such as Google Map, Apple Map, or any tracking or navigation app, you are contributing data to these companies that they use GPS tracking data to compute mobility indices such as distance traveled or social distancing measures such as the amount of time you spend at home or at work or other locations, how far you went every day. Although they don't use this at individual level, they aggregate it to use it for getting insight into mobility indices and how non-pharmaceutical interventions impacted mobility and spread of COVID-19. One example of using movement in intervention and medication responses has been to trace individuals. Basically, the idea is, can we use location-based devices such as cell phone to track individuals and potentially identify individuals who came into contact with infected individuals. There are many apps being created or has been created that the idea is that in the background they collect information about your location, and perhaps later if an individual identified as infected, they may be able to identify other individuals who came into contact with the infected individuals and try to basically quarantine them. Basically, these are built as a help to traditional ways of contact tracing, that they also have some issues. For instance, we read the other day in New York Times that there has been issues of trust. For instance, people don't answer their phones of contact tracers, or they are not trusting them to give them information about the locations they've been to. The idea of digital contact tracing would be if you have a set of sensors, either based on mobile or fixed sensors such as scanners or card readers, you should be able to reconstruct the path of these individuals and identify contact. And recently, as we all know, Apple and Google joined their effort to create a proximity-based contact tracing technology based on Bluetooth. Basically, how it works, when two mobile devices come into close proximity in a space, they exchange an encrypted code, and then they later, if one of the individuals are identified as infected, they can alert other individuals who had the code and exchange the code with this individual. The idea is that they are not tracking the exact location or absolute locations of the individuals, but the relative location of the individuals if they came close to each other or not. So all these apps and technologies that I mentioned work based on the spatial proximity. As you can see here, these two trajectories, in some parts, like these three, they came close to each other in space. This proximity is based on the distance buffer, as you can see here, for instance, 6 feet distance. If we increase that, we may be able to identify more contacts. So it's highly dependent on the distance that you use to identify contact. There are a lot of different proximity measures that we can use. One would be, for instance, to use an Euclidean distance to measure the point-to-point distances between fixes along the trajectories of people. And you can also maybe calculate the mean distance along a kernel, or use maximum or minimum distance, or other distance measures such as Harsdorff distance and threshold distance. I don't go into details of distance measures here, but you can also go further and basically use point-to-point distance of not only simultaneous fixes, but also one fix to any other fix. So all pairs of points that you have within the kernel to compute average distance. So the problem with these types of proximity measures is that they are purely spatial, meaning that they don't incorporate the time of movement, or they don't consider the timing of these fixes. So if they come close to space, they come close in close proximity to each other in space, they are identified as there was a contact. They are reliant on a distance threshold, as I just said, and usually they require the same number of fixes, same sampling rate of movement, and also basically they measure direct contacts. They can measure delayed contacts, meaning that if an unidentified went to the same location with like 5-minute delay or 10 minutes delay. So in my work, I was interested to look into contacts in the space and time and incorporate time. That's why I'm using time geography notion. Basically, the idea is that each individual movement basically happens in a space-time cube, meaning that so the horizontal dimension is space and the vertical dimension is time. And as you can see, if these space-time passes of individual come close together, we might be able to identify contacts in space and time. However, the path of individuals are not as simple as you can see in this figure, but for instance, the dynamic version showed that it can be very complex. So basically, using time geography, we can create a space-time prism that limits the area that an individual can reach between the two certain location, fixed location, like home and school. Or if you are at home and you want to come back home within a time budget that you have, for instance, 10 minutes or 1 hour, it limits the area that you can cover in a space and time, given the speed that you have, if you are walking or if you are basically biking or using your vehicle. If we project that into the space, we have the potential path area, which basically gives you all locations that are accessible to the individual within the time limit that you have and the speed of the individual. So for instance, at each point, the individual can reach a certain distance based on the time. For instance, if you have a 10 minutes, if you're walking, for instance, you can reach from the Ellison Hall, for instance, to a library within 5 minutes, but you can't reach the university center within 5 minutes if you're walking. However, if you're biking, you may be able to reach university center within 10 minutes. So basically, this limits the area that is accessible to each individual based on the time budget and the speed that they have. So the individual can't go outside this ellipse area. So if we intersect these space-time prisms or the projected space-time paths or potential path areas, we may be able to identify locations that are potentially accessible to individuals for interaction. So the red areas here shows intersected space-time prisms that maybe so they could be an area for potential interaction. Outside this intersected area, the individuals cannot basically come to contact. So what is the difference between the two approach, proximity-based approach and time geography-based approach, is that basically we don't use a buffer distance, we use a speed of individuals, information that we have about the speed of individuals, and also the time budget between the two locations. And also we don't require simultaneous GPS fixes, for instance. So another issue with the proximity-based approach was that we couldn't identify contacts that are delayed after a few minutes or 1 hour or so. Here I was basically my idea was to include a space-time prism intersection to identify delayed interaction, meaning that if an individual followed the path of the other individual to a certain location. For instance, if you are in a grocery and somebody else comes to the same grocery after a certain time. So here, actually, you're seeing two tracks of tigers in Thailand, and you can see that sometimes they come close to each other in space and time, and sometimes they go to the same location. They sense the smell of the other tiger and follow the path of the other tiger, for instance, in the space and time. So there is a delay, there's a lag to go to the certain location. So I was interested to detect this kind of interaction. So for that, we used an object-oriented approach so that the ellipse basically contains or holds information about the intersection. So basically, the potential path area is modeled in a way that it can store information about whatever contact it has with other individuals. So for instance, if you have a set of individuals, like hundreds of them, and you intersect the ellipses, each ellipse holds information about any other ellipse of other individuals, so that you can later on go back and retrieve all the direct and indirect contacts. The algorithm uses basically Cuddy tree to speed up the retrieval process. So basically the idea is that if these ellipses are disjoint anyway in a space, so for instance, if one individual is in Santa Barbara, the other individual is in LA, for instance, we are not intersecting their space-time paths, right? So we filter first of all based on the spatial proximity, and then intersect the potential path areas. So I developed a method for tiger-tiger interaction and tiger and leopard interaction. However, I was interested to see whether it works for human mobility or interaction in human movement data. And as you know, human movement is limited to network. So my colleague, Professor Kostas Goulias, kindly shared his California household survey data, included GPS trajectory data of about 176 household and 420 person in San Jose. So it's a subset of the data that he has. And thankfully, he shared his student Rong Chang with me as well. So we've been applying the same algorithms to detect contact in the data set that we have. So we applied the algorithm on the data set that we had of 102 individuals and from 176 households. So here, basically the network shows any contact that we could detect based on direct interaction, allowing 30 minutes of delay. So from 0 to 30 minutes delay, how many people came into contact or close proximity to each other in space and time. And as you can see, that there are a lot of individuals that came to contact, and basically some individuals have no contact with other individuals in the data set. So that's how you can interpret this network. And some individuals basically contacted or came to contact only with their household, which makes sense. And I should also add here that we excluded the time, the nighttime location. So these are just daily trajectories. So if you compare it with the proximity-based measure, so we identify more contacts, more potential contacts using space-time prism than a proximity or buffer-based approach. And basically, with the proximity-based approach, we only identify 9 pairs that are not from the same household, as compared to 190 pairs that are not from the same household using the time geography. So basically, we could identify more contacts of people that are not within the same household. If you zoom in, you can basically identify contacts of person-to-person contacts. So for instance, this individual had more contact with individuals of the same, of its own household. So the first part of the number identifies household, and the last 2 digits basically is the member ID. So basically the individual number 1856-2970-701 had more contacts with their household members 04, and also some contact with a person from outside household. Then based on this approach, we could also identify by allowing more delay in contact, we could identify different networks of contacts within the 60 minutes of each other, or or basically 2 hours of each other. So as you can see, then the number of pairs outside household increases, meaning that the potential to detect interaction, or sorry, contact, delayed contact for people outside individual increases, because you get happen to be at the same location at the same time of other individuals, at different times of other individuals. If we zoom in again, we can identify different types of contacts between within household and different household members. As you can see here, the blues represent within household members, and the reds represent outside household members. Okay, to summarize, so basically movement plays a key to analyze the effects of epidemics or non-pharmaceutical interventions, and especially in contact tracing or other insights about mobility of people and how it has changed, or how pandemic changes the behavior of people in terms of mobility, how mobile we are as compared to before the pandemic or during the pandemic. Digital contact tracing might be helpful, might add more information to traditional way of contact tracing. However, we should be careful about using that. There are some problems with that I listed previously, and here I summarize. Basically, tracking accuracy should be considered. Usually GPS tracking data have accuracy of 15 meters, and they might not be very accurate in some areas, especially indoor. And however, the relative positioning is more accurate than absolute positioning, meaning that if you want to compute the distance between people. The current contact tracing apps and technologies are often based on proximity based, and basically, as I showed, they can mainly measure direct contacts. They cannot identify delayed contacts. Also, if there is a barrier or any sort of, for instance, if you are in different levels or there is a physical barrier between people, they can't identify that, unfortunately. So by including more context information, we might be able to improve those measures. Often, most of these proximity-based measures cannot identify the duration of contact, and that's something that we are working on currently to identify duration of contact if it happened for direct contact. There are, of course, false positives and false negatives that we need to be aware of. And as I showed, the time geography approach basically shows the potential areas for contact. It doesn't say exactly the contact happened or where it happened, but limits the area of contact. And there are, of course, privacy and ethical issues in terms of using tracking data. We should be mindful of that, and I didn't cover it in this presentation, so that would be a point for discussion perhaps. At the end, I would like to thank Rongxiang and also Kostas for allowing me to use their data set and other colleagues who contributed to developing this methodology. Thank you all.
Thank you, Sumaya. Now we can move on to Meng Yang's presentation.
I stopped sharing my.
Can you see my screen? Okay.
Yes.
So, okay, good. So thanks, Ambush, for inviting me. So this is a project with my PhD student, Hammo Lee, second year PhD student at PSET. So let me just first show you some data, okay? The footprint. Here, this is cumulative confirmed cases per million population of the whole country. So this is from mid-March to May 19th. So you see sort of basically almost all county. So this is county level data. We plot these confirmed cases per million. So almost all county have the confirmed cases. And you see this up to May 19, you see the East Coast, it has relatively high, very high confirmed, what happened? So the East Coast actually have the kind of very high confirmed rate at the beginning. But now later on, you see the confirmed rate in the middle, I mean, in the Midwest and also the Central America, the confirmed rate are pretty high. If you look at here, the highest county I track the news is actually more than 1/10, so like 100,000 per million. So that those areas typically have so for a few area that actually have this confirmed rate, those have a small population and typically have prison and correction center. Okay, so here this is another image, okay, another video we plot. So we show you the daily confirmed cases. Okay, so you sort of from March to May. Let me see whether I can replay this again. So this is from March. You see almost no cases in the center, and then the very red in the East Coast. But later on, there are more and more red cases in the center. So this is indicating this transmission. I mean, wide transmission to more rural area. So let me show one more. So the death rate, some area are pretty high, actually more than 10,000 over a million. That's really high rate. Let me show one more plot. We plot. So this is where we come back. Let me go back. Yeah, this one. So we plot the cumulative deaths. So this is the deaths per million population. So still the similar story. The East Coast have a really large number of deaths at the beginning, but later on the middle, this Midwest area and also the South. You see here Louisiana and other places like Florida and also other area. They also have a pretty high death rate. So these are quite alarming issues. So we have this data. So this is data from Johns Hopkins. So by the way, we'll show some data mostly from Johns Hopkins University. So this is plotting the whole country, the area. There are two curves in the left panel. You see this the cumulative confirmed cases and the daily confirmed cases. Okay, so cumulative increase daily. You see a very slow trend going down the daily confirmed cases. The deaths, the right panel plot the death. So still the cumulative deaths and daily deaths. Okay, so still slowly decreasing So then people currently may think whether we should open up. Okay, so you sort of see the deaths and cumulative cases, more or less, they go back to the original one. The daily deaths, for example, is slightly higher than at the beginning, like the time we shut down the economy. Okay, so these are some graph, and then you might want to think, okay, then probably it's a time we should come out and go back to the normal life. I will shortly discuss mostly literature review in this in this talk about forecast. So there are two types of forecasts in my opinion. One is this long-term global forecast and quantify the hazard. Okay, the other is short-term local outbreak detection and prevention. So Maya gave a very interesting introduction about some equipment, some information, data sources for doing the second one, the detection. I think I will mostly focus on the long-term global forecast. So the first model, about this global forecast, the first model, just let's revisit this SIR model we discussed before at the beginning. So SIR model have three categories. One is susceptible, one is infectious, and then the recovered. And then people shift from each group with certain rate. Okay, this is the number. You shift from the susceptible to infectious, and then infectious to recover. For each one, it's a function of time. Okay, so initial condition, we mostly basically larger than 0. And this model is very sensitive, sensible model, interpretable model. You only have 2 parameters. Okay, so one parameter is this beta, which is the average number of close contact per unit time. That means how many people infective can infect per unit time. And the other is gamma, this inverse length of time. So I define tau as the length of time this infective can spread this disease. Okay, and then the very important quantity is this so-called reproduction number, this R0, which is basically how long infective can transmit the disease times how many people, how many susceptible this person can infect for a unit time. Okay, excuse me. So R0, when this is larger than this n divided by S0, if we look at S0 as the susceptible case at time 0, typically this S0 is close to n when you have a large population. So then that's how people say, why people say this R0 larger than 1, approximately 1, there will be an outbreak. Outbreak means that the number of cases will increase along with the time before it decreases. Okay, so if R0 is smaller than this quantity, and n is the total number of population, by the way, if R0 is smaller than that, there will be no outbreak. Okay, so we know that. So this just some simulation showing you how outbreak look like with the parameter value. For example, this n I set to be 450K, which is similar to Santa Barbara County. And then we fix some, let's say we fix this beta equal to 0.1 and gamma equal to 0.2. This means a person probably have only 0.1 close contact, can only transmit, can only infect one person over 10 days, okay? And then this person can spread the disease for 5 days. And then you see in this context, even we have a very large number of infected, 10 to the 5th, the red line is infective, number of infectives, it will go down. There will be no outbreak because this beta divided by gamma is smaller than 1, okay? And then here is another extreme case. We have also very small number of infective at the beginning. We have very, well, you won't see an outbreak, okay? So the lower panel plot another situation that this R0 equal to 5, or like a person can spread this disease for 1 individual per day. Okay, and then that person can spread this disease for 5 days. That R0 equal to 5. It's sort of, there are some studies showing that if we don't take any measure, that's probably the average, that's approximately the R0 for COVID-19. So if we don't take any measure, then they can do some simulation. You will see there will be outbreak. There will be a severe outbreak depending on how many, so the time, the peak, the climax, depends on how many infected people at the beginning. But if we have this large rate, we don't take any prevention strategy, actually almost all people will be infected at the end. So this is the very, so it's critical to reduce this number, this beta, okay? And then we also want to reduce the number of dates the person spread the disease that tell, and then we can prevent the outbreak. Okay, so let's talk about the forecast. People, so you might see some tutorial show, okay, that's fit the data. So previously I fixed a parameter. Very important task for forecasting is to estimate the parameter by data. Routinely used way, you might see from the internet, is to fit a certain loss function. For example, here you might fit infected cases like as a function of beta and gamma. And then let's say you fit for the first day to the tth day, and then use certain measure of this number of observed infectives, and then minimize the square loss, and then estimate beta and gamma. This is equivalent to model this YT, this infectives, number of infectives, by this complemental model, this SIR model, plus some Gaussian noise. And then if you work on this maximum likelihood estimator, you can show that that's equivalent to this minimizing maximum likelihood estimator for beta and gamma. That's equivalent to minimize this square loss. Okay, other model take log transformation of this number of cases, or they put a weight on the observation at a later time. That's correspond to time series model like autoregressive model or moving average. You might also consider the cycle, the infected cases, reported cases. You see there's a cycle. There's more during the weekdays and less on the weekends. Okay, and you can go into you can apply this for different county and specify use their data to estimate the beta and gamma for that county. Let's say for certain county or certain state. So here is one very important question, is that the question is, do we observe the number of infected, this YT? This is very important because we need the data. So remember this YT, this one is the infective that can spread this disease at this time, okay? Then you will ask yourself, do we observe this data? Then you must scratch your hand and think, this might be the number of confirmed cases minus the number of recovered cases. We have both of these data. They are recorded, okay? However, the most critical issue, I would say, that's not even some confirmed cases. We may underestimate it. By the way, we also have the test. The test rate goes down, this number of tests over time. I didn't plot it here, but we do have that data. I would say the most problematic part is not the confirmed cases, the missing confirmed cases. It's actually the recovered cases, because the date of infective change to recovered cases defined by this SIR model is a day that this infective stop spreading the disease. So you see, when infective recover, that's a really long period. And then lots of number of recovery, they are not even recorded in the system. So it's significantly lagged and underestimated. So this recovery, we don't really observe this. There might be the date that this person gets a positive test, and this person quarantine himself and possibly not spreading the disease. So fitting SIR model often leads to some problematic estimates. So let me move a little faster. So there, I will show some result of a few model. One is this IHME model. This model forecast by the Institute for Health Metrics and Evaluation. This is cited a lot by this federal COVID-19 task force and media. This is actually incredibly simple model, I would say. So the idea is like this. We don't have that infective. We can't use that directly fitting the model. Let's work on another data. That is the death toll. This is comparatively well recorded. So they use this to estimate they want to use this data to forecast the future deaths. And then based on the deaths, they can estimate the number of ventilator, ICU units, hospital beds needed in the future. That is very, very important. The idea is modeling these deaths by certain S-curve function. They take a very simple approach. So a simple S-curve function you learn in one of the stats course is a cumulative distribution function. So they model this by a cumulative distribution function of this Gaussian, or they call it Gaussian error function. It's basically a CDF of a Gaussian distribution. Okay, so they basically put this MPI covariance, this non-pharmaceutical intervention model in this parameter. They also model the fixed effect, random effect. I don't want to go into detail. I'll show you some fit we implement. They actually have a lot of parameter because they want to encode this MPI, this non-pharmaceutical covariance. So they actually have 4 global fixed effect parameter and 3K random effect. Let's say they fit this model for K number of states simultaneously. So they have 3 times K plus 4 parameter. All those parameter you don't have closed form maximum. So they minimize certain loss function, maximize the posterior. So they basically define certain prior, some shrinkage prior to make it a little more stable. And then the parameter are estimated by the maximum posterior estimation. So they have this parameter. None of this parameter has closed form solution. They all need to search them numerically. Okay, they fix certain range. They also fix the variance parameter. Okay, for all the random effect and also the noise. You might see the number of, so they give a forecast at the beginning in March, that's 80K, the total number of deaths of the country, and then changed to 60K in early April, and then changed to 130K in early May. And then now if you check their website, I think they don't even plot this. Previously they give this, but they removed that plot. Instead they give you the forecast daily deaths. So you see it changed quite a bit. Let me show you this fits. That's what we implement. That's basically what they have, very similar to what they have on April 20th for New York. So this is for New York County. This is the data. The green one is the data, and the blue one is the projection they give. Actually, this is what we implement. That is similar to what they have. You see, first of all, the fit is really good. Actually, if you look at the natural scale, the fit is comparatively really good to the observed value. However, let's put it there and look. Now we are more than it's 1 month later. So let's see the death toll. So the red one is actually the future data. That's the real one. Okay, and blue one is the forecast. You see, this is significantly underestimating the deaths. So there's one message. The message is fitting the data well doesn't mean forecasting well, especially when there are large number of parameters to be estimated or tuned numerically. You have to be careful. So then the one very important reason this model, the parameter is so hard to estimate, the reason is compared to the SRR model, it's sort of lack of practical meaning because it gives you this S-shaped curve. It does not have a practical meaning compared to the SRR model, but it's very useful at that time, forecasting the need of ventilator, hospital bed, etc. Okay, it's a very important, it's a very, very good idea to use the DAS. There are a number of papers and article studies using the DAS data because this is comparatively well recorded. Many data show. I'm sorry. So number of studies show that this SRR model fits the DAS data pretty well. So I'm showing one. I'm implementing one of this model, which is something like this. So this one group, this category, this is a group. So remember, we have infectious. The day you visit the doctor, you get this positive result, and then you're probably in quarantine, or you will not spread the disease. Okay. So there is a group that's called them not infectious. And then from the non-infectious case, there will be a time that this non-infectious case go to these resolved cases. Okay, resolved cases might be this person recovered, okay, or die, okay. And then from here to here, we have a little more parameter. This is more reasonable, I would say, because you know, we don't observe the current infectious. We observe the death. This recovery case is also still not recorded pretty well, at least in the US, but death is relatively well. So we may want to use a death to infer the previous the infectious. So there are some literature, for example, this literature, they fixed certain ones. So the death, you have to estimate, either estimate or fixed this parameter. So they fixed some parameter. That's basically, that means they fixed the average death rate to be 0.8%. Average day to spread this disease is only 5. Let's say you spread this disease for 5 days, and then you will be either quarantined or go to hospitals, etc. Also, the average number of days to have a case resolved after this person stop spreading disease is 10. This is most controversial, I would say. And then they also model the number of contacts, this beta, from a decreasing function from beta 0 to beta star because of this shutting down, this stay-at-home order, social distancing, etc. So they model it by this. And you can see here, you can actually model the MPI covariance through this beta, okay? And then the parameter need to be estimated is initial value of infectious, recovered, and beta 0, beta star, these two value of this beta t, and also the lambda, how fast it decrease. Let me show you using the same data of New York, using April 20th, and then fit that kind of model, and then to make a forecast projection. It fits relatively well, similarly as the previous IHME model, but it gives you a lot more death forecast. And then if you compare with the real one, actually it's not that similar to the future data, but I would say it's closer to this red one. The project result, I should say, is quite sensitive, still quite sensitive to the parameter value, but it's only 5 parameter, okay? So it's much better, it's easier to specify the range because it has real meaning, unlike the other model. So it's easier to have a reasonable range, and then it's not quite robust to the initial value. You still need to have multiple initial value and see which one give you the optimal minimizing certain loss function, or you do MLE. I didn't plot the error bar here because you have to introduce certain noise. So let me show one more plot, and we'll talk about the sign extension. Let me show the California cases. So unlike New York, you see here the outbreak is almost at the end. Okay, the number of deaths decreased a lot from the peak. California, this is this is a forecast of California using data up to May 20th. So you see, sort of the model still tell you this is still quite a bit, still a long way to go still there could be possibly there will be quite still a number of deaths in the future. I also plot a few other curves, which is changing the initial I0. This is infective, increase or reduce 1,000. And you see, actually, the initial value of this I0, this is critically important, the number of infections. So it sort of almost corresponds to like 1,000 deaths in the future, given all the parameters fixed to be the same. So initial value of infectives at current stage is very important for opening up the economy. And we can also plot the number of infective, as you can see here. So from this model, feed the data, we can also estimate the number of effectives. So you see here, it still give a story like California. At this point, number of effectives still pretty large. So we have to be very cautious when we, gradually opening up. We are working on quite a bit of extension by a few extensions. So one thing is we can form this as an inverse problem. So I work on inverse problem for quite a few years. So we can train this model as this complementary model as certain function. We use a certain data and try to model and try to estimate the parameter, because this parameter is also quite important, have scientific meaning. So we want to estimate this parameter. So typically people add a certain noise. Here I also add a so-called discrepancy function, typically modeled by some non-parametric like Gaussian process. And then the uniqueness, identifiability, and identity assessment is really important. We develop a bunch of software, okay? And then we also have, we also want to borrow information across county. As you see, this outbreak are quite, I think, so the time, like New York have earlier outbreak. Italy might have even earlier outbreak. So we may want to borrow information across county. This is quite important. I don't want to go into detail. So this is certain latent factor model, dynamic factor model for model the K regions data jointly. And then we also may want to combine different type of observation, because deaths are lagged in detecting an outbreak. And actually we have the number of tests and positive cases. Based on this, this is actually conservation of population. So we can still use this type of thing jointly with the deaths. This is important to detect an outbreak. So let me just end with possible data sets for our community. Okay, so we have daily number of confirmed cases and deaths, okay, of Santa Barbara County. We do comparatively, we do lots of testing compared to other county. Okay, we do lots of tests. And then we have a new test introduced by Alisa and other people in the previous talks. So we have a new cracks test. Okay, so this might be up to, we might scale it to up to like 1,000 per day for our community. The false negative rate, this is quite important because we don't, so this is quite important, but there's certain uncertainty on that. It could go up to like 50%, but we want to figure out this value. So rapid testing, recurring testing is really important. As you see, knowing the number of infected at current stage when we open up the economy, this is very important. And then we also want to measure the traffic flow and mobility data. And then this is very, very important. And then also we can also track the daily number of people who report to have this symptom to student health center. So prevention is, in certain sense, is also simple. Basically, we want to reduce this beta and gamma. This is, we want to have social distancing, face masking, reduce it. We also want to have a recurrent tests. We can reduce this the length of time. Okay. So thanks, Professor Cannon, for giving us this information about the possible data. Okay, so I will end here. So open up for questions. Thank you.
Thank you, both the speakers. I think we are into the last minute. Maybe there is one question that got asked. Let me take it from the Q&A. How do you incorporate possible data on new mutations of the virus. So would you, I mean, because that would end up affecting your beta, your gamma. So this is a question, I guess, based from Maniac.
Which one? Say again. I cannot hear you very clearly. I mean, the signal is cutting off.
So how do you, so as the virus changes over time, you need to look at the effect of the values of beta and gamma are going to change. So how would you add that to your model?
So in the previous model, I showed this SRD, this beta is modeled as sort of exponentially decreased function over time. So that one is assumption, but potentially people can put this MPI and then mobility data into that function, this beta t. So that will account for the daily number of people infective can infect. So that is sort of model on there.
Okay, thank you both for an exciting talk. Thank you to the audience, and we'll have another talk next week at the same time. See you next week. Thank you.